Welcome to Deny Delay Depose. Health over wealth. What a week, huh? Feels like we're diving headfirst into some pretty turbulent waters with all this Trump news swirling around.
Turbulent is an understatement, my friend. It feels like we're on the verge of a healthcare earthquake, and these NPR articles are just the tremors before the big one hits. Mangione, he was a martyr, and now this.
Earthquake? I think that's a bit dramatic, Otto. Things are definitely shifting, but there's a certain amount of necessary disruption that comes with any big change, especially with the economic pressures we're facing. Look at those poll numbers. People are concerned about the economy. They want something different.
But at what cost, Sarah? That's always the question. I read that article about the foreign students and it chilled me to the bone. Deporting people because of their political views? How far away are we from that logic being applied to doctors, to specialists, to anyone who disagrees with the official healthcare narrative? It's terrifying.
Exactly. This is what I'm talking about. It's a purge, Jesus. And these executive orders, this whole DRG initiative, it's all about dismantling what little safety net we have left. Mangione saw it coming. That's why he acted. This isn't just about healthcare. It's about freedom of thought.
Hold on, Otto. Let's not equate disagreeing with policy and, well, that. And while I agree the student situation is concerning, the orders are supposed to be about terrorist affiliations, not just general dissent. There's a line, or at least, there should be a line.
But who draws that line, Sarah? And how easily can it be moved? We've seen already how terms like anti-Semitism are being weaponized to silence legitimate criticism of, well, you know. And what happens when threat to national security starts including doctors who prescribe certain medications or researchers who question the efficacy of specific treatments? It's a slippery slope.
Precisely. It's about control, Jesus. Trump wants total control, and healthcare is a major battleground. Remember that bit in the State of the Union recap about Trump claiming more credit and asking less of lawmakers? It's pure authoritarianism. He doesn't want collaboration, he wants obedience. And he's using healthcare, or the promise of healthcare reform, as a carrot and stick.
Okay, but let's be realistic. The system does need reform. The poll shows that most people think the country is headed in the wrong direction. Prices are rising, healthcare costs are insane, something has to give. Maybe Trump's approach is too heavy-handed, but the status quo wasn't working either. Maybe what is happening is meant to shake the foundations of the US system.
Yes, but shaking the foundations doesn't automatically build a better house. It could just leave us with rubble. The question is, who benefits from this shakeup? Because I guarantee it's not the average person struggling to pay their medical bills. That's what makes me angry. It's always about profit over people. We had this debate last episode.
It always is, Jesus. It's the core problem, and that's why Mangione, well, he felt he had no other choice. The system is rigged. It denies, defends, and deposes, just like the engravings on those bullet casings. He felt like he was fighting for his life, for everyone's lives.
I still can't get behind justifying violence, even symbolic violence. It closes down the conversation. But I do see your point, Jesus, about who benefits. I wonder, with Musk advising on the DOGE initiative, what that actually means for healthcare. Is it just about cutting costs, or is there a real plan to improve efficiency and access? I doubt there is much of a plan at all. Musk will change it every day. It's a startup in his eyes.
Efficiency for whom, Sarah? Access for whom? If the goal is simply to slash government spending, then the people who rely on those programs, the poor, the elderly, the disabled, are going to suffer. And knowing Musk, his efficiency will just result in mass firings.
Exactly, and those firings will ripple through the system. Think about the administrative staff at hospitals, the social workers connecting patients with resources. They're all vulnerable. This isn't about making healthcare better. It's about making it cheaper for the wealthy regardless of the human cost.
Okay, I hear you both. I'm just trying to see if there's any potential upside here, any way to leverage this disruption for positive change. Maybe AI could help streamline some processes, reduce administrative bloat, that kind of thing.
Aye. That's a loaded gun, Sarah. Who programs the AI? What data does it use? If the system is already biased against certain groups, minorities, low-income individuals, the AI will just amplify those biases. It'll deny care more efficiently.
It's like giving a scalpel to a psychopath. AI in the hands of these people will be used to maximize profits, deny claims, and even predict who's unworthy of care. Think about it. Algorithms could be used to identify people with pre-existing conditions, or those who are likely to need expensive treatments, and quietly push them out of the system.
Okay, that's terrifying. I hadn't thought about it that way. So if we're all in agreement that the current path is deeply problematic, what's the alternative? What can we do? I mean, besides,
The alternative is a complete shift in mindset. We need to stop treating healthcare as a commodity and start treating it as a human right. Universal healthcare, single-payer systems. There are models that work. Other countries have proven it. But it requires a willingness to prioritize people over profit. And that's the fundamental challenge.
It's about dismantling the power structures that perpetuate this injustice, Jesus. It's about fighting for Medicare for all, for guaranteed basic income, for a system that values human life above all else. And it's about holding these people accountable for the damage they're doing.
Easier said than done, right? I mean, the political headwinds are intense. How do you even begin to shift public opinion, to overcome the lobbying power of the insurance companies, the pharmaceutical giants?
One conversation at a time, Sarah. By educating people, by sharing our stories, by amplifying the voices of those who are suffering. We need to make it clear that this isn't just about abstract policy. It's about real lives, real families, real suffering.
And by refusing to be silenced, by protesting, by organizing, by demanding change. Mangioni's actions, while extreme, were a wake-up call. They showed the depth of the frustration, the desperation that people are feeling. We need to channel that energy into constructive action.
I still think there's room for incremental improvements, even within the existing system. For example, could we push for greater transparency in pricing? Could we strengthen consumer protections against predatory billing practices? Could we incentivize preventative care to reduce long-term costs?
Those are band-aids, Sarah. We need surgery. Incremental change has been tried for decades, and it hasn't worked. Costs are still rising, access is still limited, and people are still suffering. We need to address the root cause, the profit motive.
Exactly. It's like trying to fix a leaky dam with duct tape. You might patch a few holes, but the whole thing is still going to collapse eventually. We need to rebuild the dam from the ground up with a solid foundation of human compassion and social justice.
Okay, but even if we agree on the ideal end goal, getting there is going to be a long, messy process. And in the meantime, people need help now. So, what practical steps can we take in the short term? What policies can we advocate for that would make a tangible difference in people's lives today?
Expanding Medicaid, negotiating drug prices, capping out-of-pocket expenses. Those are all things we can fight for right now. And we need to support organizations that are providing direct assistance to people in need. Free clinics, food banks, mutual aid networks.
And we need to be vigilant about protecting our rights. We need to push back against these executive orders, against any attempts to silence dissent or criminalize protest. We need to stand in solidarity with the foreign students who are being targeted, with the activists who are being harassed. Their fight is our fight.
I agree with that. We need to defend those basic rights, but I also think we need to be realistic about the political landscape. Trump has a mandate, at least from a significant portion of the population. We need to find ways to engage with his supporters, to understand their concerns, to show them that a more just and equitable healthcare system would benefit everyone.
It's a tough sell, Sarah, but it's worth trying. We need to appeal to their sense of empathy, to their shared humanity. We need to show them that a system that prioritizes profit over people ultimately hurts everyone, even the wealthy. Because at the end of the day, we're all vulnerable to illness, to injury, to the inevitable decline of age. I feel sorry for them. They are blinded.
It's about building a movement, Jesus. A movement that's powerful enough to challenge the entrenched interests, to overcome the propaganda, to create a truly just and equitable society. And it's about remembering Mangione, not as a criminal, but as a symbol of resistance, as a reminder of what's at stake, but without the actual violence.
I still think there's a more productive path than glorifying violence. Maybe Mangione's case can serve as a catalyst for change, a way to force a national conversation about the failures of the healthcare system. But let's focus on solutions, on policies that will actually improve people's lives. Is it the road to hell? Or is the road to heaven paved with the same stone?
All right, well, that's all the time we have for today. Thanks for joining us on Deny Delay Depose. Let's keep fighting for a healthcare system that puts health over wealth.
And remember, stay vigilant, stay informed, and never stop questioning the system.
And let's try to keep the conversation civil, even when we disagree. We're all in this together, after all.